Another key that we've been talking about every day is our testing capability. We have made tremendous progress. On Wednesday, we tested more than 5,000 people, our highest one-day number ever. Yesterday, we grew that number to another new record, testing more than 5,800 people. That's around a 15% increase in one day. We're moving forward aggressively, and I'd like to ask Dr. Karen Remley to explain how, but I want to take this opportunity to thank Dr. Remley for helping with this project, and also the various people that are volunteering around the Commonwealth, to include our National Guard that have really helped us ramp up this system. So, Dr. Remley, welcome.
So as you can see, this is just sort of the best way, I think, to be able to show everybody that when you talk about a test, it is not just a test. There are 5 steps that come into play, and if we're going to look at how we maximize testing, we need to think about it from those 5 different perspectives. I think the single most important one, and you've heard the governor and the secretary say the first mile, but it really is getting our patients to identify themselves as a patient who might have COVID, to find a place to go get tested, to talk to their health care provider and see if they need to be tested, and then find a place to be able to go and get that. That requires a number of things. They need to know where to go. They need to know why should I go, and they need to know the outcome of when they receive that test. We then also, so we've looked at that, and we've looked at how do we communicate, how do we share. You will see if you go to the website, the VDH website, there is a link to an interactive map where you can put in your zip code, and any doctor, any person from all over the state can see where their nearest public testing site is. Those are everything from, at times, a health department or an urgent care center or a hospital setting or a doctor's office. We are increasing those numbers every day. I was on the phone with the leading clinicians, physicians in our state, and they are committed to making sure those numbers continue to increase. We need to make sure that our clinicians know how to test. And many of you may know that yesterday, well, actually it was the 29th now, the CDC came out with new recommendations on how to test, and that you can take a nasal swab. I can have you have a mask on, I have a mask, an eye covering, a gown and gloves. We stay 6 feet apart. You put that nasal swab in your nose, you put it into the tube, you leave the room, then I go back in and I collect that sample. The advantage of that, it uses much less PPE and much less restricted PPE. It allows the individual to perform their own test, and we can do it in many more places. So if you think about it, we're going to be able to test not just in congregate settings, in areas where you test a lot of people in a short period of time, but in doctors' offices and clinics across the state. Specimen collection. When we move to the nasal specimen collection, it's much easier because nasal swabs are easier to come by than nasopharyngeal swabs, and being able to test using different kinds of media that don't require storage in cold, refrigerated, makes a big difference to accessibility. For lab tests, we are, as of today, by the end of the day, we will have contracted with 2 Virginia labs and a North Carolina lab to be able to increase our testing through the state up to 3,000 additional tests a day, as identified by priorities by the commissioner. And then lastly, test results, making sure that not only do we have those results come back to the health department so that they can understand and track where our disease is and box it in and be able to think about reopening, but our clinicians also know what to do and how to talk to that patient after they get that result back. What does that mean for that patient, that family, that community? As we remember, this is the timeline we talked about. When we first started talking about testing, we are in, as you can see, phase 2. And we are very, very quickly moving to the point where we will be in other phases. I would tell you that where a lot of states talk about phase 2, we are already there from many different ways. We've opened up very judiciously and carefully our healthcare system. We have the healthcare community is now testing. Hospitals have agreed to either teach their clinicians how to test in their offices or provide testing availability for them. So we're normalizing and getting testing out to the entire community. We've said them from the very beginning that we needed more PPE. We have that now. Then we said we needed more testing supplies. We have that now. Now we're working on education and bringing people to the table. So we'll talk more about those things going forward, I think, in the coming days. And I think that's my last slide, correct? I want to make sure. Oops, sorry. The CDC priorities for testing. I wanted to share those with you too, because we've really focused on the high priorities. We're now moving into all priorities. The health department, of course, and public health will continue to focus on high priority areas that have impact on communities and on the state, but we're encouraging our clinicians across the state to test anybody who's symptomatic, or if a healthcare provider deems appropriate, to test someone that might be prioritized who's asymptomatic, but you could imagine could be a close contact with someone who is or is very high risk and is undergoing a procedure. Next steps. I don't have my glasses on to be able to see that. I'm so sorry. So so local health districts are going to prioritize and implement their plans as they go forward. And then getting more PPE, getting testing up and going, and then also launching a public service announcement and campaign that you can help us with. Because if you think about it, I think the governor said it was March 7th, was when we said to the public, stay inside. This is a very bad disease. Social distancing is the most important thing we can do. Now we know what we want to be able to say is, it's still important to do social distancing. It's still important to wash your hands and cover your face. But if you think you have COVID-19, this is the time to call your healthcare provider, to go online and see where you can get tested, to make sure that you know if you have COVID-19 or not. There is enough PPE, enough testing, and enough things we can do for you, your family, your friends, and your community by identifying that you have the disease. And so it's important for us to change that message, and I ask all of you to help me with that.